Hello. I'm good.
Good to see you.
Good to see you.
Good to see you again. So we have a lot to discuss, and I'm going to start off by saying I'm sorry. I have some not great news about this PET scan.
Okay.
All right. From a tumor standpoint, from the head and neck, the treatment worked really well.
Okay.
All right. But you have a lot of disease in your chest now. All right. I'm sorry. All right. I'm going to read it to you so we can go over it, and then we're going to talk about a plan.
Okay.
Okay? Lots of times what that means is that, you know, when we're already staging you in the very beginning, stages, the scans look normal, but you might already have something in transition that we don't know about at that time because everything looks like it's normal, but it's already gotten a little bit out of the bag, and we don't know that at that time because all we got is to go by the scans, and then the next set of scans come in 3 months. All right? When I look at this scan, in your right lower lung, you have a new nodule, and that highlight how active it is up to 6. All right, and then also in the area between.
And what does that mean by how active? So is it very active?
Yeah. In the chest area, it's brighter than what we want it to be. Like I said, we want them to be 3 or lower, and having it up to 6 makes it really suspicious for us. Okay. All right, and then they also said that in the area between your lungs and sort of your heart, we call that your hilum and your mediastinum area. You also have multiple new nodes in that area, also hovering around 6 that are worrisome for metastasis. And then in the back of your neck, posterior right neck, which is an area that we normally don't see the cancer at. Normally the cancer sticks here, but in the back of your neck, you have a new lymph node on the right side.
And what would that mean since they came up and he's had chemo?
Yeah, he can still get more chemo.
How? I mean, just I can kind of, I can handle the reality of whatever it is. I mean, is this really bad or?
It's really bad.
Yeah.
This is like kind of slicing through you like kind of a loaf of bread, and this is your right lung, your left lung, this is your windpipe trachea, this is your spine here. So, just cutting to the chase, this is your lungs here. This was the thing they were worried about, right here.
Right.
You know, looks pretty solid, ill-defined, looks sort of nodular in size, and you know, I think they were appropriately worried about it. So it's gotten substantially smaller. I know these aren't equivalent pictures, but you know, they measured, I think it went from what, like 2.4 to like 1.5 or something. And there is like a haziness around this. I mean, you know, cancers don't get smaller.
Right.
Unless you're treating them or something.
Right.
So this is likely all infection.
Okay.
We should keep a close eye on it, I think, you know, but it's gotten smaller, so you know, I mean, that's what that's what we want to see, you know, since it got smaller. I mean, I would be equally concerned seeing the first PET scan and seeing how that looked. I mean, I think that was not an overcall. I think that was appropriate. But I would say overall, is all the findings on this new CT scan are all great news.
Okay.
It's all sort of and lymph nodes can be a little enlarged from an infection too. I mean, that's the classic problem with the PET scan is that if there's an infection, it can look just like sometimes can look. I mean, sometimes it can look just like a cancer.
Okay.
I don't very often get to give good news.
Well, that's good.